My name is Andrew Wolfe. I'm a board-certified plastic surgeon in Denver, Colorado, focusing on cosmetic plastic surgery. A significant portion of my practice is devoted to facial rejuvenation surgery, facelift surgery. And one of the most common questions I get is, how do I know when I'm ready for a facelift? Facelifts have really become much, much less taboo. It's no longer limited to the rich and famous, and it's something that your average person may very commonly want. But I see a lot of patients who come in perhaps when they're a little bit younger and they're not sure if they're ready. And so what I tell everybody is there are two components to being a good candidate for a facelift. And one of them is an anatomic issue. Is there enough laxity in the face that by simulating what a facelift is going to do, if I can pull on the tissues and elevate the soft tissues in a way that is pleasing to me, that's pleasing to the patient, and corrects what they don't like, at least physically, that makes them a candidate for surgery. At the same time, there's a significant psychological component on the patient's part. They have to be motivated enough by what they see in the mirror to want to have surgery. And the surgery is not inexpensive, although it's very safe. It is not without risk. There are scars associated with it. Again, they tend to hide very, very well. But these are things you want to discuss with somebody. It's not something where you just come in and have it and you're back at work the next day. There's some recovery associated with it. And so some given patient has to be motivated enough to undergo the surgery. If what they don't like about their face is very mild and they can live with it, my general recommendation is you need to live with it as long as you can live with it. And at some point, what you see in the mirror becomes unsatisfactory enough that the surgery makes very good sense for you. I'm more than happy to tell patients that they're not ready for it. I see younger patients, I have patients in their 20s who come in thinking they need a facelift because they saw somebody on TV who had one. And if their tissues don't move, if I think they're not psychologically an excellent candidate for it, I'm going to tell them that they're not ready yet. I have patients who call me Dr. No, because I come in every couple of years and am I ready yet? Not yet. And at some point they may be a good candidate for it, but we're not going to recommend surgery or allow surgery for somebody who's not a good candidate.